Hello, welcome back. In this third and final video lecture, we're going to talk about the national databases, including such things as the National Practitioner Data Bank and others. Okay, an example of a national database is the National Practitioner Data Bank, if you will, the NPDB. And this is a database of medical malpractice payments, adverse license actions, and professional review actions. So, for instance, if a physician lost clinical privileges at a hospital, it was created from the Healthcare Improvement Act of 1986, and this is required reporting. So hospitals, if they take away somebody's privileges, that needs to be reported to the National Practitioner Data Bank. And there are penalties for non-reporting. And this data is used in the credentialing process. So in other words, when a physician applies to get medical staff privileges, typically a piece of that is a check of the National Practitioner Data Bank, right? So the idea is by sharing this information nationwide, a physician with poor outcomes and a lot of medical malpractice can't just hop from state to state and pick up where they left off. We also have nationwide state and other county public health databases. Saw a lot of this with COVID, where we're looking at surveilling certain disease and incidents per 100,000, right? And this data is collected by interviews, physical exams, and reviewing medical records, of course. One thing that we were heavily involved with at the Kaiser Division of Research, and medical offices and hospitals participate in this as well, is the National Healthcare Survey. These are considered public health surveys, and they're split into several parts: the National Ambulatory Medical Care Survey, the National Hospital Ambulatory Medical Care Survey, and of course, the National Hospital Care Survey. The data points and the data collection methods vary a little bit, but they all basically do the same type of thing. They're collecting data from these various healthcare settings to inform policy and research. Vital statistics track births, deaths, marriages, and other life events, and this supports public health surveillance. And we do a lot of linked birth and infant death data sets. One thing that we use for cancer survival rates, if you will, is the Mortalink, the database that states have for their death certificates. Now we get into clinical trials, and these are research projects where we're looking at new treatments and tests, and we have different protocols. And we did a lot of this for the Kaiser Division of Research, right? And basically, somebody has a new vaccine, new oncology treatment, new medical device, or maybe they're taking a medication that's been around for a while and trying it for a new use. All of these are examples of clinical trials. And we have the Health Service Research Database, right? And these are things like the Healthcare Cost and Utilization Project. They support research on healthcare delivery and outcomes. Something some of you are already familiar with is the National Library of Medicine, or Medline, and these list biographical listings for publications. So we can look and see how many publications on a certain topic, where they came from, who's the researcher, and all these different types of things. Right. And we use different tools to link out to other things. So people can collaborate not just nationwide, but potentially throughout the world. We also have the health information exchange. A lot of these are basically a way of sharing electronic health information. So as some patients move from one system to another, their health information goes with them. Now, this facilitates the sharing of patient-specific data for care and research. We also use this type of data for performance measurement and improvement. And some examples of this are the Joint Commission core measures, right? We use things on core measures for heart failure, acute myocardial infarctions, right? And this is required by Joint Commission. CMS also requires database for core measures, right? And most major health plans. So where does this leave us? Well, of course, all the roads lead back to auditing. Auditing is essential to have accurate, relevant, and reliable data. And we have methods for correcting errors, cleaning data, and we have a systematic audit trail. The goal of this is to have high quality information that continues to improve healthcare. And that's all I have for you. Please reach out if you have any questions about any of this material. We'll see you online. Bye now.